The global pandemic COVID-19 has brought a sudden shift in the education of nursing students. In order to address the concern of education, a new system was established and remote teaching strategies were employed. However, too little training and forced readiness have been a constant challenge during these times. As educators play a significant role in the learning of the nursing students, they are also given the task of utilizing teaching strategies that will enable them to learn skills and lectures despite the sudden shift. Therefore, determining the use of these strategies facilitates the further improvement of the current strategies being used by nurse educators in an online setting. Good day, everyone. I am Mary Chris Delegero, and with me are my research members, Joshtin Lemahr Chiong, Sofia Mae de los Santos, Justin Hope del Olmo, and Maria Jealine Demegillo, presenting to you our study entitled Teaching Strategies of Nurse Educators in Facilitating Online Learning for Nursing Students. The purpose of this study is to identify the various teaching strategies utilized by nurse educators in conducting online learning for nursing students, as the pandemic has confined nursing educators and students to the safety of their homes. The objective of the study is first, to determine the nursing educators' profile variables in terms of sex, age, educational degree, course assignment, and length of experience in teaching. Second, to determine the preferred teaching strategies of nurse educators in facilitating online learning for nursing students in cognitive and psychomotor learning when taken as a whole and when grouped according to the aforementioned variables. Lastly, to determine if there is a significant relationship between the teaching strategies of nurse educators in facilitating online learning and the aforementioned profile variables.
For the research design that was utilized is a quantitative descriptive research design. This was utilized as it enabled a direct description of the teaching strategies that were being used by nurse educators. This research design enabled the obtainment of statistics regarding the demographic variables of the nurse educators and to interpret it through percentages, means, and frequency count. Moreover, this also enabled a clear view into the relationship that may exist between the demographic variables of nurse educators and their preferred teaching strategy.
This research utilized a two-part researcher-made questionnaire made through a Google form. The Likert scale was utilized in order to measure and determine the level of agreement and disagreement by the correspondents. In order to ensure the validity of the questionnaire, we used the Gooden's validation tool and examined by the three professionals. The results were interpreted as excellent. After gathering the sample data, we used the Cronbach's alpha in order to determine the reliability of the instrument, which generated a score of 0.905 and was interpreted as excellent. This section presents the results and discussion of our study. Table 1 shows the demographic profile of nurse educators, which composed of age, sex, educational degree, course assignment, and length of experience in teaching. It appeared that the most of our participants was dominated by females, middle-aged adults, nurse educators with master's degree, nurse educators that were assigned under RLE, and with teaching experience of less than a year. The demographic profile of nurse educators was necessary to identify its relationship to their preferred teaching strategies.
So for Table 2, this presents the preferred teaching strategies of nurse educators according to their demographic profiles. As a whole, nurse educators prefer the use of psychomotor teaching strategies as compared to cognitive teaching strategies. When grouped according to sex, both male and female nurse educators prefer the use of psychomotor teaching. This also goes with age, educational degree, course assignment, and length of teaching. This just goes to show that the preference of psychomotor teaching strategies by nurse educators also relates to the fact that nursing is a skill-based profession, in which laboratory skills mostly utilizes your demonstrations and return demonstrations, which is under your psychomotor category. As lectures are important, it should also be kept in mind that the number of oral ERs to learn the basic and essential skills is important. Therefore, the results of this table correlate to the fact that the most utilized teaching strategy is your psychomotor strategies, for this facilitates the learning of your laboratory skills of the nursing profession.
Lastly, Table 3 presents the relationship between the preferred teaching strategies of nurse educators and their demographic profiles. This shows that among the variables, only the nurse educator's course assignment has a significant relationship to their preferred teaching strategies, as the p-value is less than 0.05. This implies that the nurse educator's course assignments, which include related learning experience and both lecture and related learning experience, influence the preferred teaching strategies in facilitating online learning for nursing students. Psychomotor teaching strategies aim to improve the skills and capabilities of the learners. Therefore, it is appropriate for nurse educators to utilize these teaching strategies since related learning experience aims to develop the competence of nursing students in the clinical area. For the conclusion, nurse educators often utilize psychomotor learning teaching strategies to deliver course content and lessons to nursing students. Also, nurse educators select teaching strategies in facilitating online learning for nursing students according to their course assignment. Nurse educators who teach RLE utilize teaching strategies that are mostly directed to the nursing students' psychomotor learning. However, some of them also prefer cognitive learning teaching strategies. Lastly, nurse educators who handle both lecture and RLE course assignments almost equally utilize both cognitive and psychomotor learning teaching strategies.
The main focus of our recommendations in relation to this study hinges on three solid points: innovation, acknowledgement, and interrelation. All three are key components in fostering quality and effective methods of teaching in an online classroom setting. First, nurse educators must be digitally equipped to handle an online environment. The amount of preparation of an educational organization's personnel to shift into digitized processes facilitated by technology and software is known as digital readiness. Next, acknowledgement of the preferred teaching strategies of nurse educators must be evaluated and voiced out by nursing students. This is in order to give the nurse educators a sense of clarity in what students prefer. And lastly, both teaching strategies and learning strategies of nurse educators and student nurses, respectively, must be given the highest regard to better establish a familiar setting for both parties. On the bottom right corner lies the QR code that, when scanned, leads directly to the references of this study. You may scan it and feel free to peruse on the basis of our content. Thank you all so much for listening to this brief overview of our poster with regards to the teaching strategies of nurse educators in facilitating online learning for nursing students. We bid you all a good day and God bless.